Whoever coined the phrase man's best friend must have owned a hunting dog, or at the very least have had the privilege of witnessing a well-trained team in action. The relationship between humans and canines has deep roots, and nowhere are those roots more evident than in the relationship between hunter and dog. You share a synergy, a bond, based on months, years even, of consistent training, patience, persistence, and a common passion for hunting. You go to great lengths to keep your dog fit and healthy. And yet, like many dog owners, you may be unaware of a hidden threat to your dog's health, an easily preventable threat as you're about to discover. You're always on the lookout for ways to optimize your dog's performance in the field. No one knows that better than Dr. Kyle Kerstetter, a diplomat of the American College of Veterinary Surgeons, an avid outdoorsman who enjoys retriever training, hunting, and writing in his spare time. Dr. Kerstetter has expert knowledge and a keen personal understanding of what goes into the making of a good hunting dog.
You need to decide what it is you want in a hunting dog. A lot of people want a Ferrari type hard charging dog, and other people want a more sedate kind of dog that's just going to roll through a field very quietly. Once you make that decision, the way to go is find a reputable breeder that's got those kinds of dogs. The genetics that go into making that type of dog doesn't necessarily ensure that you're going to have good performance, but it certainly puts the odds in your favor. The next step in ensuring optimal performance out of your hunting dog is to get a good book. Bring that book home and read it before you even bring the puppy into your household. That gives you a good solid foundation to start your training, and eventually, even if you want to go with a professional trainer, your dog's going to have that foundation that's going to allow it to just excel over time. The third part is providing a great nutritional base, and with that, what you're doing is basically putting high octane fuel into a dog that is going to benefit from it. Now, in order to get that high octane fuel to do what you need it to do, the last part is putting your dog on a good deworming program. That's kind of like the fuel filter that allows that fuel to get to where it needs to go so that your dog is going to be able to perform at a high level for a long time. She's almost 11 years old and she'll still charge through a field hard all day long. The four most common types of parasites are hookworms, roundworms, tapeworms, and whipworms. You can see by watching these dogs that they're in great shape. And you might wonder, geez, these dogs are so healthy, why should I be concerned about intestinal parasites? Virtually all puppies are infected with hookworms or roundworms, and they get them from their mother. Even as dogs mature, they still can have exposure to intestinal parasites, which can cause a variety of problems. So that can cause them to be anemic, and they can't be at the top of their game when they've got these intestinal parasites kind of dragging them down.
As Dr. Kerstetter mentioned, there are four major types of intestinal worms that can infect your dog. Although the life cycle of the different types of parasites varies, they all eventually take up residence inside the intestine, where they develop into adult worms. Adult female worms lay eggs that are expelled in your dog's feces, contaminating the environment. Worm eggs and larvae can survive a long time under harsh conditions, just waiting for the next dog to come along. And so, the cycle continues.
The most common injury that occurs is injury to the intestines from the parasites themselves. This can result in vomiting, diarrhea, constipation, abdominal pain, or just an inability to flourish. They can do everything from robbing a dog of the nutrients that you provide in those high-energy dog foods to actually drinking a dog's blood. Other things that can occur due to intestinal parasites is even injury to the liver. Now, in young puppies, roundworms can actually result in obstruction of the intestine if the infestation is really high. This can result in the need for a surgical procedure. In addition to that, roundworms actually migrate through the lungs in order to get back into the intestines, and they can cause such injury to the lungs that you can get pneumonia. Adult dogs especially are asymptomatic. They don't have any problems. The intestinal parasites are still there, and those dogs act as a vehicle to spread them around to the neighboring dogs. Dogs can pick up intestinal parasites anywhere that they're congregated together. What happens is the fecal material also is going to build up in those areas, and what results is the worm burden becomes higher. In areas like this kennel, detergents and bleach can eliminate or at least reduce the worm burden. The other thing to remember is that worms can be transmitted from other areas, not just fecal material. Mice and other rodents, raccoons and foxes all can harbor intestinal parasites that can be transmitted to your dog when they're out in the field.
Kennels, training and testing fields, hunting clubs, wherever and whenever dogs congregate, exposure to intestinal parasites is possible. How can you protect your dog against intestinal worm infections?
Maintaining excellent hygiene. Clean up fecal material as quickly as possible to decrease the worm burden in the environment. Second, regular veterinary visits are important. A veterinary fecal examination is going to help establish what the worm burden is in your dog, as well as maintaining what the worm burden is in the environment. The deworming program that you're going to use is going to vary depending on what part of the country you're in and what the climate is. As a general guideline, puppies should be treated at 6, 8, 10, and 12 weeks of age, and you should treat the dam at the same time that you're treating the puppies. Now, in general, dogs that are over 6 months of age should be dewormed every 6 months, depending on what the fecal examination done by your veterinarian shows. Characteristics to look for when you're choosing a deworming product include its effectiveness against the most common intestinal parasites. It should be easy to administer, and it should be safe to use in all dogs, including puppies and pregnant females. The active ingredient in Safeguard, fenbendazole, fits the bill as the ideal deworming agent. It's effective against roundworms, hookworms, whipworms, and some tapeworms. It's extremely safe and highly effective for use in all dogs 6 weeks of age and older. One common misconception that many dog owners have is that they have complete parasite control with the use of monthly heartworm preventative. Although many of the heartworm preventatives do control some other intestinal parasites, they often don't pick up all 4 of the major intestinal parasites. Since Safeguard has no known drug interactions, you don't have to worry about giving it to your dog, even if you're already giving monthly heartworm preventative. In fact, the two complement each other very well, giving your dog greater parasite protection and you greater peace of mind.
No other over-the-counter deworming product controls and prevents more canine intestinal parasites than Safeguard Dewormer. As an added convenience, this do-it-yourself dog dewormer is available at many pet, feed, and hunting retail outlets, making it easier than ever to bring home the game, not the intestinal worm infections. Administering Safeguard Dewormer couldn't be easier. Just pour the granules on your dog's food for 3 consecutive days, twice a year, for complete peace of mind. You can even register online at www.safe-guard.com to receive a reminder when it's time to repeat the treatment. Intestinal parasites are a very real threat to your hunting dog's performance.
By establishing an effective parasite control strategy, you're not only protecting your dog, you're reducing the worm burden in the environment, making hunting clubs safer for everyone.
It's time to declare open season on intestinal parasites.